Well, good Wednesday evening to everyone. Brother Kelvin and Popo, 2nd District Representative, here again coming to you live with our weekly and monthly webinar as we continue to deal with this COVID-19 pandemic. Let's get started. For those of you that are new, let me introduce our horsemen that have been with us for over a year. We're going to start off with Dr. Boykin, who is a retired pediatrician and always brings us information as it relates to our young people. Dr. Boykin, good evening.
Good evening.
And we're all ears.
All right. Well, thanks so much for introducing me, and to everyone out there. Thank you for being here with us tonight. There's a lot of information going on out there. A lot of people are wondering about things, but we've been doing this, as Brother and Pofo said, for a long, long time, at least over 60-some weeks. And as a result of that, I have developed my own battle cry. And my battle cry is mitigation and vaccination. So what does that mean? That means that we have to continue to mitigate. Mitigate means the things that we do to prevent the spread of COVID-19, the 3 W's we're always talking about. And the other thing is vaccinate, if you choose to vaccinate. And I do recommend it highly because, with mitigation and vaccination, this is our best chance to put this behind us and return to some semblance of normalcy that we had prior to all of this. So, with vaccination, we can stop some of the spread of these variants out there. We can begin to do more things. And the consequences of getting COVID-19 disease are many out there. I mean, there's something called the long haul syndrome that people get when they've gotten the disease. And you're going to hear a little bit more about that tonight with someone who's living that experience right now. But before I get into that, I just want to update folks on the Johnson & Johnson vaccine. As you know, it was put on pause for a little while when they found out there was a lot of people having blood clots from, well, not a lot of people, I should say, but people were having some blood clots they felt were associated with it. So they put it on hold and they tried to come back the next day, but it didn't have enough data to resume the vaccination. So the CDC and the FDA got together and tried to figure out what exactly was this going on. So they looked at what is the background of this. And the background of the problem with the Johnson & Johnson vaccine is that there were 6 women initially reported in our vaccine vaccine adverse effects reporting system. Is how we first came about the discovering about these clots. And so that was a safety backup. That was a safety mechanism. It means the safety that we employed for these vaccines was working as we anticipated and as we expected to do. So they said, well, what is the background of it? And I'm not going to go into all of that detail, but what happened was after they studied the effects of it, they found out it was not the same as any regular clotting disorder or clotting problem or low platelet disorder. They found out it was related to what we call immune-mediated thrombocytopenia. And so they named this disease thrombosis with thrombocytopenia syndrome, or TTS. And when they looked at it, they found it was very, very similar to the same thing that happened to AstraZeneca in Europe, the same type of problems. And the reason for this is significant is that both of these vaccines are what we call the adenovirus or viral vector, or the so-called Trojan horse vectors for delivering the information so that the body can prepare to produce antibodies to the COVID-19. So make a long story short, and overall they found that there were 15 cases of this TTS, and the ones that were significant were 6 out of those cases. And then when they analyzed the data, there was some clotting associated with the other mRNA vaccines, but they were probably pre-enrolling in study, and so not found to be significant a part of the mRNA vaccine. So the mRNA vaccines do not have the same propensity that we see right now to have the TTS syndrome. So the bottom line is they figured out that this is a very, very rare association with the Johnson & Johnson vaccine. So then they looked at, well, to resume the vaccine, what do? We have to look at the risk versus benefits. So again, they looked at the epidemiology of the COVID-19 disease. They looked at the clotting factors and clotting disorders all together. And there are data to show that these clotting studies are entirely different from the immune-mediated one that you see after the vaccine. So in other words, if you have a tendency to have a venous thrombosis, emboli in your legs, or pulmonary embolus, or in your back, whatever, they are not the same as those that you get with the immune-mediated thrombocytopenia and thrombosis after the vaccine. So they said, well, what do we got to do? What do we got to do to get the vaccine vaccine resumed? So after a whole lot of analysis, and which is beyond the scope of this talk here tonight, they finally decided that it is safe to resume the vaccine for all ages. With one caveat is that women under the age of 50 should know there's a rare chance of getting this TTS syndrome if you receive the Johnson & Johnson vaccine. It occurs within 1 to 2 weeks after vaccinate, with the median onset about 8 days or so. And the other thing they found out that the highest risk was between the ages of 30 and 39, and no one over the age of 65 had this clotting problem. So they re-released the vaccine, understanding that some people might not want to take the vaccine, but the vaccine is very, very safe because 6 cases out of over 8 million or 15 out of over 8 million is very, very low compared to the risk of getting clotting disorders from COVID-19 disease in and of itself. If you're young, you have and you get COVID-19 disease, you have a risk of developing clots, which are not the same as the clots that you get from post-vaccine. You have a higher chance of getting the clotting problems after the vaccine. So the other thing that they were going to do is that release this vaccine with that particular information in the paperwork that comes with the vaccine, and also if you are of this particular age group, make sure that you have on hand other vaccines that are approved for COVID-19, and persons should have the choice to take that vaccine after they're well informed about the clotting propensity. So with that, I want to say that the vaccine is very safe. It's back on the market. There is no reason not to take the Johnson & Johnson vaccine. You don't have to worry about it if you already own blood thinners or aspirin that you can't take the vaccine because you can. And likewise, you don't need to take aspirin or any blood thinners to take the Johnson & Johnson vaccine. Those young women between those ages of 18 to 49 and 50 should be aware of that. And they've also come up with treatment and screening for physicians to look for the diseases and the symptoms associated with TTS after vaccination, and already develop a treatment plan. So with that, Brother DR, I'm going to yield back my time, but I wanted to bring those things to the forefront because I know people are worried about the Johnson & Johnson vaccine, and it's very, very safe to resume. It's safe to take it, particularly if you're a male. You have no risk factors for taking the Johnson & Johnson vaccine.
Understood. As always, Dr. Boykin, thank you so much. We appreciate you for all that knowledge and wisdom that you drop on us. Let me bring our next doctor, Dr. Dan Phillips, no stranger to our community. You've seen him around right out of New York, the epicenter where this all began. Dr. Phillips, good evening, my brother.
I'm good. How you doing? I'm good. I'm just getting my camera straight.
It's all good.
Good evening, brother Ampofo. Good evening, Dr. Boykin. Again, thank you for the information so far. Again, I think that we have some reason to feel good. I think with the news of what came out yesterday with the relaxation of safety measures for those who are vaccinated has shown that the vaccine has made some dent and some difference. In addition to that, we've seen an improvement in the numbers of our elderly or older individuals who were once the most vulnerable and suffering the most. Those have seen great decreases in hospitalizations and death rates. Unfortunately, with that, we've also seen an increase in the number of cases in our younger individuals. Unfortunately, with that being said, I feel like we're in an action movie, and we're in a fire, you pull yourself out of it, and the fire's behind you. And the sign of the fire behind us, we need to look at what's happening in India, and we need to look at what's happening in Brazil. And those are areas where you don't have vaccine available as you do in the United States. You have overcrowding as you do in some areas of the United States. And you see that people are not in a position because of other social and other socioeconomic factors that may prevent them from practicing with vigilance those mitigating factors that Dr. Boykin just mentioned. So again, as we look into this new risk that we have, because we are still at a risk of things getting worse. We would like to see things get better, but again, in order for us to get back to normalcy, we have to stay vigilant. Because as I said, we might have gotten out the first fire, but there is one still burning behind us, and we've got to keep pulling ourselves up. And part of pulling ourselves up is we've got to get this message of the vaccine to our hard-hit communities. We have to understand that in those communities, because of legacy of mistreatment, because of historical economic inequalities and other medical issues, those communities are very reluctant. And those include our younger individuals. You know, initially when we got the messaging out of talking to people about the vaccine, we were talking to the elderly and the older individuals and those that had complicated medical histories, because those were the individuals that were being impacted the most. But at this time, we are seeing that that is shifted to our younger people. As we will see tonight, COVID is nothing to play around with, y'all. Because again, even though Dr. Boykin just said, most times younger people won't get sick or as sick, most times they will not get hospitalized as much. They are still happening that younger people are getting hospitalized. We are starting to see the long hauler symptoms occur with more regularity or higher prevalence in our younger community. And again, as our guests will share with us later tonight, COVID is nothing to play around with, even when you are at the top of your game. So with that being said, we have to continue to be those COVID ambassadors, because again, everybody may not have a Dr. Boykin or Dr. Phillips or whatever healthcare provider you may be associated with. They may not have that. They may need their friend. They may need their relative. They may need their coworker or neighbor to really clear up some of this misinformation. Another thing that needs to happen, if you are trying to elicit efforts in communities that have been hard hit, we've got to partner with community-based organizations, faith-based organizations that have a legacy of helping those communities. And we have to also identify individuals that are trusted leaders in those communities so that we make sure that the messaging is coming in an appropriate way. Because unfortunately, with the co-theme of social justice that has been going on during this pandemic, you know, things like a George Floyd trial can affect people's decision to get vaccinated just as much as people thinking the vaccine has live virus in it. So we have to lean in, be compassionate. We have to make sure that we understand, as we get to this approach to trying to be more normal, we are not going to be normal unless everybody is experiencing some improvement from this pandemic. And with that being said, my brother, I yield my time. Thank you.
Dr. Phillips, as always, thank you so much. Dr. Phillips, Dr. Boykin, as always, to our guests that have been here before, just for those that may be new, certainly want to acknowledge the DRs that are on from across the country. Good evening. Our NPHC brothers and sisters that are joining us tonight, certainly want to say good evening and welcome. If it's your first time here, I just got to let you know, be mindful. The comments and views expressed by these individuals tonight are their own. They do not necessarily represent Omega Psi Phi or the entities that these brothers and guests represent. As always, we thank y'all. We're going to go to our next horseman, Brother Wonzie Gardner. Listen, this brother's just had a powerful story, powerful experience, but he brings to us the information from the government. Brother Gardner, good evening. Good to see you, my brother.
Brother DR, Brother Dan Phillips, it's very nice to see you and my fellow horseman, Brother Dr. Boykin, Brother Dr. Phillips. It's so good to be in your company again. And I want to piggyback on what Brother Boykin said earlier about mitigation and vaccination. And I also want to put in what I call controlled relaxation. As you guys are aware right now that the federal government has eased or relaxed the restrictions on people that have been fully vaccinated. But I want to give you that with an air of caution. Being in the room, and again, these are not comments that are non-attributional to anyone, but just to let you all know there is a battle going on between those that want to hold the line and those that feel that we have to have some kind of relaxed measures to let people know that once you get vaccinated, there is some sense of normalcy. As you guys are fully aware of right now, that if you're fully vaccinated, people can be outside and do physical activities without wearing masks. They've also said that you can fly and you can go to different places in a restrained manner. But what I want to talk about is the fact that even though the federal government is relaxing these guidelines, we as a people, we've got to be on top of this. And why do I say that? The biggest issue we're facing right now is we've got almost 50% of Americans have had one shot, and the doctors can correct me, I think it's 25 or 30% have had 2 shots or more, and people are feeling good about themselves. But roughly there's about 70% of America that has not been fully vaccinated or have the shots. There's about 50% of us that don't want to take shots. And why is this so important? We can't get that herd immunity. And what I'm afraid about is this: our communities are sometimes the last ones to benefit from things. We're still in a struggle to try to make sure we get as many people vaccinated as possible. So as Brother Phillips talked about, there's a fire behind us. We can still smell the smoke. We still see the burning embers. Just because you're vaccinated does not mean that you should throw all caution to the wind. We had to relax those guidelines because Americans, we are like a microwave type of community where we want instant results. We've been at this thing over a year now, and we've all suffered traumatic deaths. We've seen over 500,000 of our citizens that are no longer with us because of COVID. We're not even talking about the people that are still impacted, that are still with us. And so the message that I want to bring today is the fact that, yes, we are making progress. Yes, we're trying to get to some sense of normalcy. But just as when you're running, when you see the finish line, now it's not the time to quit, but it's time to surge on with the last push forward. And why is that so important? Our community called America is just only one aspect of this global community. As Brother Phillips talked about, India and Brazil are at our doorsteps. And what our biggest fear is this: although we're vaccinated, there could be a strain around the corner that could come back and cause us to go back to day one. And why do we say that? The science tells us that this virus mutates. If it doesn't mutate, if it mutates too fast and finds a lot of hosts, it can change and keep going. And so imagine yourself like this. You've got a team. Half your team is vaccinated, the other half isn't. You're going to intermix, you're going to play with those people, and sooner or later something's going to pop off. So while we should take not a victory lap right now, but pat ourselves on the back for the work we've done thus far, but now is not the time to let your guard down totally. So here's what I would tell anyone: if you're vaccinated, follow those CDC guidelines. But just like God gave you mind, use it. You know when your spidey senses go up where you shouldn't be doing something in a certain area. And so while it may not affect you, but somebody you know might get affected. So you just want to make sure that you're not putting yourself in a position to cause yourself bodily harm or somebody else. But those comments, Brother DR, yield my time back to you. Thank you very much.
As always, Brother Gardner, it's a pleasure. Thank you so much. It's good to see the horsemen. In our customary form, we have a very special guest on tonight. We always acknowledge our brothers and sisters of the NPHC, and tonight the winner is the ladies of Delta Sigma Theta Sorority Incorporated. Now, she has a story that I want to make sure you had your chance to get your popcorn and get your refreshments. Listen to this powerful story. Miss Angelica Taylor from Houston, Texas. How you doing, my soror?
I'm doing okay, hanging in here.
Wonderful,
Glad
wonderful.
to be
Listen,
here.
yes, well, listen, we are blessed to have you. You have a story that I think people need to hear, and we're looking forward to it. So at this time, we're all listening to you. You have the floor.
Okay. I want to start off by saying thank you so much to my brothers of Omega Psi Phi, for allowing me to use their platform to share my story and use my voice. So I'm just going to give some background on me, who I am, who I was before COVID, and then share on my experience with COVID and long COVID. So I'm a 28-year-old from Houston, Texas, as stated, born and raised here, and I am a COVID long hauler. So prior to COVID, I was a healthy, happy, free-spirited, super social, always involved in 1,000 things at once. That was the person that I was. In 2015, I graduated in mechanical engineering from the Southern University and A&M College, where I was a Southern University dancing doll, and also crossed the Alpha Tau chapter of Delta Sigma Theta Sorority Incorporated Spring 14. And I was also a semi-professional dancer, and I began dancing at the age of 11, and I've danced consistently since then. My dance career has been quite extensive, to say the least. I've had the opportunity to perform on a number of stages across the U.S., and I've danced most notably in the Super Bowl 46 halftime show with Madonna, MIA, and Nicki Minaj. And since being back home in Houston, I've danced in various shows, music videos, projects, just all types of different things across the city. And I was actually dancing up until the point where I contracted COVID. So I had a show probably like 2.5 weeks prior to COVID. So I've always been required to maintain a certain level of health and physical fitness throughout my life. I also currently work as a business analyst in information technology, and my job is super demanding and, it requires long hours. And in 2019, I began my graduate program at West Texas A&M, where I was pursuing a master's in business administration with a concentration in computer information systems. So I've always been very, very busy and always had an astounding amount on my plate. My only pre-existing condition was a very mild case of asthma that I was diagnosed with when I was 7 years old. And it was, managed to the point that I never have issues with my asthma. And as you can tell, it never impacted my ability to dance or anything like that. So back in March of 2020, the pandemic, was just starting to make its presence known here in the United States. They began to recommend that everyone lock down, quarantine, and I took all of those necessary precautions, obviously, because I have asthma. And so for weeks, I didn't leave my house. I didn't even see my mom, and my mom lives 10 minutes down the street from me. And so at one point I just said, okay, I decided, let me allow one visitor to come to my home because I needed to have some communication with this person. So I said, it's really early. You didn't really think you knew anybody with COVID. So I was like, I think I'll be safe. So I allowed this one visitor to come to my home for one visit, and that one visitor and one visit changed my life indefinitely. And I always like to stress this point because so many of us think that, as long as I'm not in a big crowd or as long as I'm only around people that I know, I don't have to take the recommended precautions. I don't have to wear my mask. I don't have to social distance or anything like that. I'll be safe. And that's not necessarily going to always be the case. And that was not the case for me. So this visitor was asymptomatic. They exhibited no symptoms at the time, but they did end up being COVID positive. So my initial symptoms were none of the most commonly publicized symptoms at the time. So I've never had a cough. I've never had a fever. I never lost my taste of my sense of taste or smell. I initially started to experience fatigue. That was my first symptom, and that came on the very next day. But I didn't really make the connection that, this could be COVID. And then I developed an accelerated heart rate, shortness of breath, burning in my lungs, and tightness in my chest. And those symptoms made me be like, okay, this is probably COVID. So I did get tested, and obviously it did come back positive, as well as my asymptomatic visitor. I was lucky enough to be afforded a test, while so many people in that first wave were not able to get tested and are now suffering for that and being penalized for that and being, turned away or denied care because they don't have a positive test. And so for me, within that 2-week time that I quarantined, I never even stopped working during that time. My symptoms were pretty mild, and I was able to just go on about, my life. And I was outside exercising and just, really starting to think that I was coming out of it. I was feeling better. And at the 2.5-week mark, exactly, everything took a drastic turn for the worse. So all of those initial symptoms began to amplify. And I also developed pneumonia in my right lung. So even at that point, I was not severe enough to be hospitalized. So they sent me home with a course of antibiotics, and I continued taking those. And I said, this has to be it. After I finish this course, I'm coming through this. I have to be. But that was not the case. So during about month 2, this is when I entered into what I consider my most acute phase of my illness. I developed the most severe neurological symptoms. So I developed numbness and pressure, tingling in my head and my face, tingling in my limbs, pain in my spine, stiff neck. I had my arm and my face actually go paralyzed temporarily on 2 occasions, on 2 different nights, tremors, intense inflammation, muscle jerking, oxygen levels were dropping intermittently. And it was almost as if the signal from my brain to my lungs was not happening to tell my lungs to breathe. So my breathing became manual instead of automatic. Like I had to tell myself, breathe. I developed gastrointestinal and digestive issues, POTS, breathing pattern irregularities, insomnia, bruising over my entire body, random drops in my blood pressure to the point that I would pass out. Shortness of breath really, really intensified, extreme hair loss. I lost probably about, I would say 70% of my hair. I lost over 30 pounds. And if you knew me before, I did not have 30 pounds to give. So I had extreme weight loss, disturbed cognitive function, diaphragmatic flutter, exercise intolerance. I started to develop anxiety and depression, and those were things that I, never experienced before. And the list goes on. A post-exertional malaise, so I was unable to do any type of exertion would, send me into a deep relapse. So, and also my lymph nodes were always very swollen. And so even at the 10-month mark, I thought this has to be the point where I'm coming through this. And I ended up having a very, very severe relapse where I was almost, experiencing that initial set of symptoms all over again. And that was suspected to be brought on by overexertion. Currently, I'm still dealing with chronic fatigue syndrome, post-exertional malaise, dizziness and feeling faint, POTS, gastrointestinal issues, intermittent headaches and head pressure, inflammation, depression, and the list goes on as well. So one thing that has helped me through all of this is being a part of a couple of long hauler support groups. And the crazy thing about the people in these groups, and I always like to mention this as well, is that so many of them were young and healthy people prior to COVID. Many of them were athletes, gymnasts, weightlifters, marathon runners, people who took exceptional care of their bodies and had no pre-existing conditions. So anyone, as has been stated, is at risk of having these long-term effects. So at this point, I'm still debilitated. I'm still having to have the help and the care of my mom at this point. I had to actually move back in with her, during that very acute phase. And I only just was able to come back home in January. But now, because of the relapses that I've been having, I'm having to have her move back in with me. And so over this past year, I've had countless ER visits, countless doctor visits. I've seen so many specialists that I cannot count them anymore, only to, continuously be sent home with no answers and told, just wait it out. It'll get better with time. I've experienced medical discrimination as a Black woman. I've been gaslighted, and this is probably the hardest part of it. I was rushed to the hospital in an ambulance in one instance with stroke symptoms, only to get to the ER and be told by the ER doctor that, oh, you're too young to be having a stroke. We won't even do any type of scans or tests for you. We're just going to send you home. I had to really advocate for myself to have a CT scan, something, as basic as that may be for that type of symptom, those types of symptoms. I was told by a pulmonologist and a cardiologist to just get back to my life and stop thinking about COVID, as if I don't live each and every day in constant discomfort, unable to do much of anything. And I think there's a lot to be said when a large majority of the long haulers in these support groups that I'm in have given up on even trying to see conventional doctors due to, the fear of how we will be received. And for most of us, these groups have been our doctors. These groups have provided the help and the information that we have been using to try and help ourselves. So only within this past month have I been blessed to see a new internal medicine doctor who has studied and who specializes in chronic fatigue syndrome and viral illnesses and their long-term effects on the body. And she was able to actually hear me and listen to me and believe me. She did tons of blood work and tests that have actually validated, all of the things that I've been feeling. And she assured me that she would do all that she could to restore my health. So since then, she's placed me on a treatment plan in hopes of rebuilding my immune system, because at this point I don't have one, stimulating the growth and restoration of new mitochondria and influencing the reproduction and retention of the ATP in my body. And I've also started a 12-week neuro recovery therapy program. And this has been the first time in a year that I've left a doctor's office with some sense of hope or some sense of help. This year, unfortunately, I was forced to drop out of my graduate program due to my ongoing and exacerbated symptoms. And at this point, the fate of my life, it just seems so cloudy and obscure. Nothing is certain as of right now. I don't know if I will ever dance again. I don't know if I will be able to complete my graduate program. The only thing that I do know is that I won't give up, and that I'm going to keep fighting to win this battle. So my last words that I want to leave everyone with, advocacy. What do we need? We need everyone to advocate for themselves. Don't take you're fine for an answer. Don't take just wait it out. We have to advocate. We have to bring awareness to what's going on with people like me. And with that being said, I want to thank you guys again for allowing me to share.
Wow. I mean, let me, if I can, doctors, Brother Wonzie, I'd like to start with you. Obviously, I just like to start with you, Brother Gardner. Before I go, Angelica, let me just say, powerful story. What I wrote down was this. One visitor. This is what you said, your words. One visitor changed my life indefinitely. Mm-hmm. That's powerful. Brother Gardner, I'd like to start with you, please. Some comments for our sister.
Can you hear me now?
Yep, there you go. Go ahead.
Okay, Sister Angelica, I'd like to thank you for your boldness of a force of what you talked about in your testimony, because I can share that with you. My daughter-in-law is suffering from that right now, long hauler. She hasn't been to work since January. And the symptoms you talked about, she's facing those right now. I've been hit all kind of ways. So this is real personal to a lot of us on the screen. And your comments about advocacy are so right on. But more importantly, I think your comments about being the young, those that are fit, those that are in good shape, this virus is not a respect of person, place, or time. It hits anybody, anywhere. And I think one of the biggest tragedies we talk about is the fact that we don't tell young people forceful enough that you are at risk. And to me, any death is tragic, any loss is tragic. But to see a young person in the prime of their life being struck down, it's just hard, right? And so I want to applaud you for what you're doing. Stay with your mom as long as you can. Don't be one of those that are trying to be so bold and so strong that you got to get out there, use that support structure you have, and be an example to those others out there that are facing what you're facing, and to continue to advocate. Because sometimes when we see people that look like you, and you're a beautiful young woman, by the way,
thank you,
and strong and strengthful like that, and can stand up and say, hey, look, I too was at all that at one time, but I too am suffering now. You give a lot of people hope and strength in the fact that they too can come forward and step up. And also, I'd also advise you and ask if you would talk to us maybe about your mental aspect. What went on with you mentally? How are you coping mentally with all this you're going through? Because I know that's a heavy burden for such a young, active, vivacious woman like you are to deal with it. So how are you coping with this situation mentally? You talked about the physical aspects of what's going on, but mentally, where's your mind at right now?
So I think mentally I've been hit especially hard because of the life that I used to have. I think, and not to, for anyone who may not have been as active, not to say that they're not mentally impacted as well. But for me, it's just been really, really difficult not knowing the possibility of, will I get better? Will I be like this forever? You just don't know your true destination. And so for me, mentally, I have really, really been on a roller coaster.
Mm-hmm.
Initially, like I said, because my symptoms were kind of severe or mild, I was like, okay, I'm going to get through this. I'll be fine. So at that point, I was very optimistic. I had no doubt in my mind that I was going to be back at it, within the next few weeks or months. And so I think over time, I have mentally deteriorated to the point that now, like I said, this doctor that I've most recently seen has been the only thing that has given me a little bit of hope. So prior to that, I actually went through a period where I did not want to live anymore. I didn't want to live. And I told my mom, you know, I don't want to do this anymore. I didn't want to see any more doctors. I didn't want to have any more opinions given to me. I didn't want to read or research anything else. I just wanted to sit down and just wait to be taken up, you know? So I think that with the support, like you said, of my mom and other people that I have around me, they were able to bring me to a point where I said, okay, I'm going to keep fighting. I'm going to give this one more chance. And if this doctor, if this doctor doesn't tell me something, then I'm done. And so she's been such a blessing. And I think that was God saying, this is what you need to keep pushing. And so since then I have, you know, a new sense of hope. I have my days, you know, where I feel better and I'm like, okay, this is it. And then I'm knocked back down the very next day. And mentally that triggers, you know, another relapse of I'm going to be in this chronic cycle for the rest of my life, you know? So even today, I'm still, you know, on this roller coaster and I'm trying to find a more positive and optimistic outlook consistently, but it's been very difficult.
Hey, Angelica, I would just add one more thing because I'm going through it now too. Get some mental help. There's a lot of help out there, and you'd be surprised. And one of the things I'm learning on my own personal journey is the fact that your mental health is just as important as your physical health, and your mental outlook, your mental attitude. And a lot of times there are coping mechanisms out there that we don't know anything about because we've never experienced those. And we've always been taught to be that brave, strong person. Do yourself a favor. And that's this doctor you're talking about. Tell her you were advised to get some mental help. I'm pretty sure she can find it for you. But whatever you do, just remember this: one day at a time, one step at a time. And I just love your smile. You're gonna make it. You know, we don't know when, we don't know how, but you're gonna make it. Okay, so don't give up on yourself because we're not gonna give up on you. Okay, thank you so much.
Thanks so much, Brother Gardner. Dr. Phillips, please. Just come off mute, Dr. Phillips, so we can hear you.
I'm good. Today must be the technical night. We having a whole lot.
Yeah, a whole lot. You know, it happens.
I think Angelica got us all a little nervous tonight. You know, we're trying to make sure we do our best. Well, Angelica, thank you so much because I think your story, number one, you know, kudos to you for your bravery with your transparency. You know, there are a lot of people. I have a friend on here right now who's dealing with long hauler symptoms and was experiencing, called me up and said, what do I do? You know, went to the doctor, had COVID last year like yourself, went to the doctor initially last summer and they had no answers. And after that, going multiple times, taking time off from work and other things you have to do, got frustrated and reached out to me recently and said, I don't know what I can do, and shared some tears, which really touched me. And it speaks to, again, how many people are extremely impacted by what we're seeing with this COVID. And as we said earlier, we're seeing younger people that are being impacted with COVID. We're seeing younger people that are being influenced or impacted by these long hauler symptoms. And unfortunately, aside from the non-medicinal things that are impacting people, we're seeing COVID take away people's future. And again, I think seeing a story like yours, my sister, gives all of us some strength and some resilience and some strength to be vigilant. Because again, this thing is no joke. You know, I think the other thing that is important, because again, everybody does not have the connections or the network, but they may have long hauler symptoms. You know, trying to find a medical center that has a post-COVID clinic sometimes is more effective because they have multiple specialists that are under one roof, so that the results, because as Angelica mentioned earlier, we are going to need multiple disciplines in approaching a cure for COVID. It's not just a pill. It's not just an operation. It may be seeing a specialist. It may be seeing a therapist. It may be doing physical therapy. It may involve medication. So again, we've got to be open, not just with open mind, but vigilance in our heart to do that. Because again, even though, as I said earlier, we are at a place where we can feel good a little bit, as long as individuals like yourself, my sister, are saying what you're saying right now, then our work is not done. And we've still got to get out here and lean in and understand why our young folks are reluctant to protect themselves, because if they don't want to listen to Dr. Phillips or Dr. Boykin or Brother Gardner, they better listen to Miss Taylor, because if it can happen to her and she was safe, it can happen to anybody else. And unfortunately, as you have seen, what about the individuals that may not have the village that you have? What about the individuals that don't have that, fortitude that you know about oh so well? All of those things, again, can happen. And with that, everything can be different. So again, the only way we can get away from that fire behind us is we got to continue the mitigating interventions. We got to mask up. We got to wash hands and surfaces. And we've got to make sure that we have good information to make a good decision about being vaccinated. And in my humble opinion, you should be getting vaccinated. And with that, I'll yield back my time.
Dr. Phillips, as always, thank you so much. Dr. Boykin, you got to talk to us about now this, let's follow up what Dr. Phillips is saying about this vaccination. Go ahead, come off mute and talk to us. First, share some comments about Ms. Taylor's story, and then give us that vaccination for the kids.
Okay. Well, first of all, thank you, Angelica, for coming on. I mean, you have hit every point, every category, every ounce of anything about long hauler syndrome. I mean, they should have taken your story and written the text about it. They should have taken your story and written a treatment plan, because you're absolutely right. Unfortunately, we're seeing long haul now in pediatric patients. The youngest long haul patient in pediatric that I'm aware of is a 9-year-old, which is very much like yours. She went to school one day. She couldn't do anything. She kept getting in trouble. They thought she was just acting out. She was so tired. Went home and eventually tested positive for COVID-19. And now she has long haul syndrome. She can't stay awake long enough to do anything. So, and with that being said, the centers have to be developed to catalog these things and figure out what it is we're dealing with. That's first and foremost. What is the whole gamut of things, and what is the treatment approach? Because it's not a one shoe fits all, one size fits all type of situation. So I am very, very encouraged by the fact that you didn't give up, and that you said the most important thing that I tell any patient or any other person that within the sound of my voice: be an advocate. Advocate for yourself, because advocacy is the best thing that you can do. Even as a physician, as a patient, I as a physician patient had to do some advocacy for myself on a certain thing. So advocacy is the number one thing. Now with the vaccines, there is hope out there. The Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine all have studies ongoing for pediatric patients. And I think it's going to be important, because when schools open back up in the fall, we want the middle schools and the high schools to be vaccinated. And Pfizer is the only one right now who has been fully utilized for 16-year-olds and above since the beginning. Now, Moderna and Johnson & Johnson were 18-year-old and above, but Pfizer is 16-year-old and above. But Pfizer's recent data suggests that in their under 16 to 12 to 15-year-old groups, there's 100% efficacy in their vaccination. So that's the group of high schools. That's the ones that are going to mimic the young people that are going to spread the disease. Those are the ones that are going to probably be the asymptomatic carriers that don't know about it. So vaccination is very, very important. And I do realize that in the school situation is mostly the adults that have the COVID-19 and spread it to the kids and then back to the adults again. So it's a adults to kids to back type situation there. But even having said that, vaccination is the best means we have to shut this thing down. As I always say, if there's going to be a pandemic bust, it's up to us. And part of that is, do your research, do your due diligence. If you want to be vaccinated, be informed. Don't listen to Dr. Google or Dr. Facebook or Dr. YouTube. You got to listen to people like Angelica. She's a living proof of why you should consider getting vaccinated. If you don't want to get vaccinated, I'm not going to be mad at you. But just remember, you run the risk of developing long hauler syndrome like she did. Because she wasn't vaccinated at the time, because vaccines weren't available at that time. So I'm sure had she had the ability to have a vaccine, she probably could have avoided this. And the fact is that, as Dr. Phillips always says, COVID don't care who you are. Don't care who you are. Children are dying of COVID. Children are being hospitalized of COVID. There's a problem in Michigan right now with not enough hospital beds for children with COVID-19 disease. So, I think, we got to forget about this developing herd immunity on our own, because it's not going to happen. That's what happened to Brazil. Brazil thought that, okay, we've had 70% of people that have had the disease. Now we can stop worrying about it, and they opened everything back up. What happened? We had the development of the P1 variant out there, and that was taken to Hong Kong. That's how it was discovered. It was visitors from Brazil in Hong Kong. So, we can't sit back and say herd immunity is going to do, because this is a novel disease that we have. The virus is not new because it belongs to the coronavirus family, but it's a novel disease. And we still need to study more and more things about it. That's why the vaccine is going to help us get there. And as Dr. Phillips said in the beginning, we're riding down this long road. We can see the city off in the distance, but we're not quite there yet. So don't be fooled by the fact that people keep saying that, there's light at the end of the tunnel, we're almost there, because we are not. We still have a lot of work to do. And just remember that in our own communities of color, we might not have access to the care. So we got to do things like the young pediatric surgeon in Philadelphia is doing, getting out there vaccinating people by going to homes and vaccinating people. We got to do other things like that. Our faith-based communities, anybody in the community, the COVID-19 community core, all those are resources for us to get out there and vaccinate people that want to be vaccinated to help bring this pandemic to a halt. So with that, Brother DR, I yield back my time for more questions.
Yeah, so let me ask you guys this. Let me ask the doctors, because there's people out there. I'm not talking about the people. I think you make a great point, Dr. Boykin. So for 30 seconds, let's not talk about the people that for whatever reason they decided they're not getting vaccinated. I want to talk about the people that are really on the cuff, the people that this entire time they haven't been vaccinated. They have been fortunate. They haven't contracted COVID-19. And today they see our commander-in-chief basically come off and say, if you've been fully vaccinated, you can, you're okay without being a mask. How do we make sure that people understand that if they're on the fence, what do they need to hear about the vaccine and not be confused with, thinking that, everything is about to be okay? What are your thoughts on that, Dr. Phillips?
Well, I think one of the other points that's coming up is understanding what the vaccine efficacy means. So again, when we talk about with Pfizer or we talk about with Moderna or J&J, and we say Pfizer's 90%, Moderna 94.5% efficacious, that means that it prevents you from serious illness and death. We know that, again, that is the way usually that individuals will end up dying. They have to get seriously ill. The other thing that we've seen is individuals that tend to have long hauler symptoms have had more serious outbreaks of COVID. So again, understanding what that means, it does not mean, even though some of the live data has shown that people that are vaccinated or environments where you have a greater amount of people vaccinated, there's less chance for people to get infected. There is still a possibility that a person who is vaccinated could be infected. So again, let's go back to what you said, brother Ampofo, about going out into public. So if I'm fully vaccinated, I come to your crib and you've got a group of people over there, 8 of the 10 of them are fully vaccinated and 2 are not. And if we are all not wearing masks, and that say those 2 people might have health issues, we could theoretically put them in the situation that our Miss Taylor is in. So again, that is why if you want to be in a space where without, feeling like I did something wrong or I'm cheating, that you can wear a mask more confidently, I think the only choice you have is to really truly consider vaccination. The other thing, if you don't take away from what Ms. Taylor said, is you could be doing the right thing, and then one time, all it takes is one time. Again, my wife lost a first cousin to COVID recently. I've known some other people that have had people that have died from COVID recently. So again, we're not just seeing people that are dying last year. Look at what's happening in Michigan. Again, the numbers are going up, and it's starting to overwhelm their health system, not into the surge or level that we see in India or Brazil, but again, something to think about. As I said, we got to keep running forward because the fire behind us is still burning, and we are not going to protect ourselves from being burnt by that COVID fire just because you have had the luck of the Irish thus far. And I don't mean to, I'm not offending anybody, but again, my point is there's a whole lot of unpredictability. You might have been lucky thus far that you didn't get COVID, but that does not mean that you can walk boldly moving forward. And like I said, these long hauler symptoms, there are a lot of things that we do not know about them. And really, one of the few ways you can protect yourself right now is to protect yourself from getting seriously ill from COVID, which is considering the vaccination.
Okay. Dr. Boykin, and then I want to ask Brother Gardner a question. So, Dr. Boykin, if you want to chime in on that.
Sure. So let me just say, and Dr. Phillips is absolutely right. You know, people that get severe disease can get severe can develop long haul syndrome. But what you don't hear about, what you don't see in the news, that you can be totally asymptomatic and get long haul syndrome. Let me repeat that. You can be totally asymptomatic and develop serious long haul or long-term COVID. So don't be fooled by the fact that, you know, things are looking good now because we've been vaccinating people and, you know, things are kind of, you know, numbers are going down, cases are going down, but that's just where we are in this particular space in time. You can still get it. You know, there's no one out there, even if you have been vaccinated, you can still get COVID. Because remember, you know, the whole idea behind the vaccines is to prevent death, prevents hospitalization. So don't be fooled by that fact, you know. And if you're seriously considering it, I always learned in medicine, probably Dr. Phillips remember too. If you think about should I have done that test when you were on call that night as a resident, you probably should have done that test. If you think about getting that vaccine, you probably should get the vaccine. So I'll leave it at that for for Brother Gardner.
Powerful. Brother Gardner, my question for you is, I think a lot of people we hear the numbers, we're watching the news, and we see that some people are still choosing not to get vaccinated. The concern comes in all of these medications that we have, right? All of the vaccines that we have, I'm talking about, that are not being used. And of course, the concern with the shelf life. Has there been any discussion, are you aware of, or can you share, are we as a country maybe looking to assist other countries with vaccinations? We know what's happening in other countries. Any thoughts or comments on, our country assisting other countries that may need the vaccine?
The short answer to that question is yes, Brother Amfofo. But the issue is when and how. The concern is as we produce, and one of the things that has been noted is the power and the awesomeness of our industrial complex. How we were able to turn out two vaccines. AstraZeneca is another that's coming out pretty soon. But the fact that we've got so much medication going is the dilemma we have is an ethical one of do we help others before we help ourselves? And the problem is that other 50% of America that has not gotten vaccinated. We want to make sure we have enough in reserve for them while at the same time assisting others. Because one of the things we've got to understand, this is a global pandemic. As we talk about, pandemic means everywhere, a broad spread. Just because the shores of America are safe does not mean that shores other countries are safe yet. We keep talking about India and Brazil, but there are 103 other countries out there in the same position. The concern that we have right now, and this is all about money, to be quite honest with you, and patent rights, is how to release it, how do you control it, how do you make sure that the vaccine keeps the same amount of efficacy in these other countries if it's mass produced someplace else. So while we do want to help out, we will help out. And I think there are shipments on the way right now, some forms of help to India as we speak. I don't think there has not been a decision made to release any large quantities of vaccines to other countries, but it will happen. The question, though, more importantly, is how do we take care of our own? How do we convince that other 50% they do need to get vaccinated as well? And that's the big dilemma we're facing right now as a country.
Outstanding. We are coming close to that time where we hate, where we get ready to prepare to say goodbye. So let me do this. Let's do our closing remarks, 2 minutes or less. We're going to start off, ladies first. Ms. Taylor, again, thank you so much for joining us tonight. Thank you so much for sharing your story, how powerful it is. And our hope, our prayer is that this helps someone. But as we prepare to close, for all of you, we're here at the end of the month. We're getting ready to start May. You know, today where we are, it was 90 plus degrees. So people are ready to go out. People are, you know, tired of being home. Any closing remarks you want to make as people prepare for the summer and or otherwise get ready to just break out of COVID? So, Ms. Taylor, your closing remarks, please.
I would just say to be careful, because, you know, people are going to go out, they're going to socialize and do what they would like to do. So I think most importantly, being careful and realizing that you are at risk and realizing that there is a chance that you could be sick. You could become sick and have long COVID effects. So just, you know, staying safe, taking the precautions, wearing your mask, social distancing, washing your hands. That's all that I can recommend. And I also want to add that I am vaccinated as well. So I got my second shot 2 weeks ago with Pfizer.
Awesome. Awesome. Congratulations. We are, I think this is an all vaccinated panel on here. That's what I'm talking about. Dr. Boykin, 78, please, your closing remarks.
Well, you know, like I said in the beginning of this thing, and Sora, Angelica said the same thing. Mitigation and vaccination is the way to go. Mitigation means you got to follow the guidelines that have been put out there. You know, the 3 W's: wear your mask, wash your hands, and watch your distance. If you've been fully vaccinated, that's cool too. You know, you still can go out and do all the things you want to do outdoors, but remember, indoors is the same thing follows in terms of mitigation. Just because you're vaccinated doesn't mean you can't spread the virus if you contract the virus. So I say to you all, mitigation is the way to go. If you don't want to get vaccinated, mitigation. But I do hope you will seriously consider being vaccinated. So mitigation and vaccination is the way we're going to put this pandemic behind us and get closer to where we want to be, some things of normalcy, and getting back to doing the things that we worked so hard over the last year to try to get to this point for. So with that, I'll say, everyone out there, be safe and do the right thing. Thank you.
Thank you so much, Dr. Boykin. Dr. Phillips.
All right. All right. Ms. Taylor, thank you so much. Again, salute to Brother Anthony Spriggins, Beta Sigma 1983, for connecting Ms. Taylor to us, to give us this opportunity to help us amplify the message and to let people know how big of an issue that this is. Again, like I said earlier, there's a fire behind us, y'all. If y'all don't believe that the fire is burning hot, y'all got to look at India and look at Brazil. Those countries are on the verge, and that could easily be us, because more virus, more mutation, more variants. And if we have more variants, then the mitigating factors such as masking, not masking, but vaccinating may not be as effective. So again, we've got to make sure that this little bit of success that we have, that we can get together in small groups without a mask if you're fully vaccinated. Let's not get satisfied with that. It's not going to be good till it's all of us able to be together. And with us to get to that point, we have to make sure that we stay vigilant, y'all. I understand, again, it was 75 degrees in New York today, and I wanted to get outside and run the streets. But again, the streets got dangers with them, and COVID is waiting for you to let your guards down. And just like she told us, all it takes is one time to change everything. And there are a lot of people that are suffering in this same way, and we want to prevent others from dealing with this so we can focus on helping those that have been impacted thus far. So we need to stay, as Dr. Boykin says, we need to mask up, we need to wash our hands, we need to watch out for unsafe circumstances, understand these new CDC recommendations so that we're operating safely in light of them. In addition to that, educate yourself. If you are a person that got your kids living in a house, they going in and out, and they're talking about, I'm not getting the vaccine, sit in and find out why they don't want to get vaccinated. If there's misinformation, correct it. Direct them to the CDC website or other trusted sources. In addition to that, if there's a fear there, maybe you might need to be the one that needs to get the vaccine first to let them know it's going to be all right. But again, we've got to make sure that we lean in to our young people, because we are seeing them to be more impacted by this COVID. And if we want this thing to be behind us, if we want that fire to be put out, then we cannot get laxed. We cannot relax. We've got to keep pushing. We've got to stay vigilant. We've got to stay we got to stay diligent, you know. So with that being said, y'all, be safe, lean in, be a COVID ambassador, wear your mask, and thank you very much.
Thank you, Dr. Phillips. Brother Gardner.
First, Brother Fofo, I want to say I'm honored to be on this panel. And Sister Angelica Taylor, can't thank you enough for the words you spoke tonight. And to my brothers and those out there that are listening to us, we've been doing this about 60 some odd weeks now. And the whole purpose of this was to show that for us, by us can work. And if we can help save one person to do the right thing, if we can help save one person by making them think about what they're doing, then our efforts have not been in vain. We can't force anyone to take any of these measures we've asked for. And I'd just like to add on what Brother Boykin said in the realistic terms. He said mitigate, vaccinate, and now I think I want to add what I call control relaxation. The CDC has loosened our guidelines on, but we can't loosen our eyes on the prize. And so I hope that as we go through these summer months and people feel empowered and have these extended liberties, they take a step back and think about the what if could happen. And that's not to make anyone scared or afraid, but just to make you think about what could happen to you or your family members. So I want people to be out there and enjoying themselves outdoors, but do it the right way. And so many times we've often been accused of not leading by example. Let's be that group that leads by example, doing the right thing the right way at the right time for the right reason. It's all about saving us. This is not about individuals anymore. It's about us. So with that comment, Brother Amfofo, I thank you for this time. And I thank my other brothers and our guest speaker for the words they shared with us tonight. And thank you very much.
Thank you so much, Brother Gardner. And to all of our guests that are here, again, thank you so much for joining us. This is brought to you by the brothers of the 2nd District. The 2nd District of Omega Psi Phi Fraternity Incorporated. We're comprised of the states of New York, Jersey, Pennsylvania, Delaware, and Maryland. We're going to be back in 2 weeks as part of our public forum for our 73rd District Conference, which will be virtual. You can look on our website for that link. We're going to have some powerful speakers that night. We're going to hear from the Red Cross, the National Kidney Foundation, the horsemen you've heard from tonight, as well as some special guests as we talk about social justice. I want to thank all of you so much. And as we move towards the summer, continue to please wear your mask, wash your hands, watch your distance, stay safe. On behalf of all the brothers of the 2nd District, thank you for joining us. Stay safe and stay well.